All right. So, um, if you go to talk to somebody about health insurance, there's a lot of rules and things like that you need to
Mm-hmm.
know. So, healthcare.gov right here is a really good resource. Health Sherpa's got some stuff in it too, but this website, uh, when you log on to it, healthcare.gov, I'll show you the homepage. Have you spent much time on here at all? Probably not
No.
because you're new to it. All right, so you can go to Get Answers and you can start right there, or you can start at Get Marketplace Basics. You can also search. And I'll say this website, compared to just about any other government website, this is a good one. So if you click on Get Marketplace Basics, it starts walking you through Medicare and Medicaid, qualifying for health coverage, who can get marketplace coverage. What they've done is they've done a good job putting links into a lot of these descriptions. So if it's premium tax credit you're wondering about, it's going to tell you more about it. But just rely on healthcare.gov. If you've got extra time and you just want to look through, and read things that you don't know already, healthcare.gov is good.
Mm-hmm.
We may refer back to it here in just a
Okay.
second. Um, so let's use your person as an example. You said she's a nurse practitioner and she's coming off employer coverage because she's going through a divorce
Yep.
and she's got a
Right.
couple of kids. So we don't know her income exactly. So we'll guess at it, but I want to show you a few other different incomes too and show you how they impact the plans. So uh, we'll use our zip code, 35630. How old do you think this lady is?
Oh gosh. I'd say 38.
All right. And then how old are her kids?
Ooh, I have no idea. I'd say like 7 and 9.
All right. Um, One thing about the kids, it's going to depend on who claims them on their tax return. So if the husband claims them on the tax return, he may be liable to put them on his health coverage. I'm not sure. But if she's going to claim them on her tax return, then she can add them to her insurance policy. If she doesn't claim them, she can't add them, or at least she can't get a tax credit for them. So, uh,
Okay.
all the healthcare.gov stuff, it just about everything you wonder about is always going to come back to the tax return. If you got a question about something, always make the tax return the first thing you think of.
Okay.
All right. How many people are in the household? There's three. All right. Take a guess at her income.
Oh, long.
And it doesn't matter if you're right or wrong because we're going to change it a few times, anyways.
I would say 70,000.
All right. And it's adjusted gross income. So when they're coming up with this number, most people it's just their gross income, but there are some deductions and tax credits that people get that affect it. So it's called their manually adjusted gross income,
Mm-hmm.
and they can go back to uh, their tax return. It's like line item 31 or 32 or something, but it's called Maggie, MAGI. That's the income they go off of because most people are familiar with gross, before tax, and then net, which is after tax.
Correct.
Her 70s probably gross. She may only get home with like 50, but she still may have something that brings it down below 70. You know what I mean? So,
Right.
uh, and then honestly, the tax return's a good thing to refer to, but they're just guessing. They're just trying to estimate their income for the future. So, nothing has to be perfect. They just want to get as close as they can. All right. So, based on her income, it's saying that she can qualify for a $262 a month tax credit. So, she's going to have options like 20 different options to choose from on health insurance. No matter which one she chooses, she can take $262 off of it. Does that make sense?
Mm-hmm.
All right. And then it's saying her kids are should be eligible for CHIP, which is Medicaid. It's it's a higher level of Medicaid, but um, it's actually insured through Blue Cross and Blue Shield. But they would still apply through the state to get that. In this application, there may be a way to just send their information to the state. So, in this scenario, based on her income, she would get health insurance. Their health insurance would come through CHIP or All Kids. Have you ever heard of All Kids?
Yes.
Okay,
Yes.
so that's what they would qualify for. Um, Let me go back before I go forward. This would be one good time to do this. All right, let's say she made $40,000. She'd get a $538 discount.
Okay.
All right, let's go back and say she makes $20,000. She does not qualify for a tax credit. She's got a household size of three and she makes $20,000 with a household size of three right here. Can you see the screen, Monica?
Yeah. Yeah,
All
the
right, so
25.
yeah, because your income's under 25,000, you don't make enough. So in this situation, if that lady said that I know I'm not going to make more than $20,000, technically she doesn't qualify. $5,000 is not a lot of money. So she could say, well, I've got the ability to work more hours. Instead of estimating 20, let's estimate 25,000 or 25, 26,000, and then I'll make it my goal to earn that amount of money. That's fair to do. What you don't
Okay.
want to do ever is lie to the system. Like if you know that lady's not going to be earning more money, technically you're just helping her fill it out. So it's her lying on her behalf. But it's also not fair for somebody to get penalized when they're just taking a guess to begin with. So let's say it's somebody that cleans office buildings, somebody that goes around and cleans windows or offices or a hair cutter, somebody that cuts hair, that's
Mm-hmm.
working 2 days a week that says, hey, I'll probably make $20,000. Well, if she knew she could get free health insurance, she could choose to work 3 days a week and earn enough money to qualify for it. Does that make sense?
No, it does. Yeah, definitely.
All right. So all that in mind, these numbers, I mean, you have the ability to put in whatever number you want to do it the right way. We need to get as close as we can get. And so educating people on how this works, is important. So let's say that lady said, okay, I can make 26,000. Then you put that there. Now she's going to qualify for, a big tax credit. And the kids still go to All Kids. Let me go back one more time. Let's say she makes $150,000. She's
Hmm.
going to get a $36 discount. So it's not much, but that person's making a lot of money too. So you can see
Exactly.
that really almost anybody you talk to is going to qualify for some kind of tax credit. You'll learn based on this calculator who's going to get the cheap plans. Let's do this. Let's bump this household. Let's say they make 150,000, but there's 10 people in the house. Now that tax credit's up to 113.
Mm-hmm.
Uh,
What about if, okay, so another situation with the one I've got, she's a Lionette at UNA, but her Medicaid is dropped now because of her age. She needs insurance, but she doesn't work. How would that work? Go through her mother? You
yeah.
said earlier.
So in that case, her mom, and this is what we need to get verified, but her mom would apply for her to have coverage. The
Okay.
mom would stay on Medicaid. But if the child's coming off of Medicaid, is it because she's turning a certain age that she's coming off
Yes.
Medicaid? Well, if she
Yes.
still lives in her mom's house and her mom files a tax return, then she can apply with only her daughter being covered. Does that make sense?
No, it does. Yeah. Okay. So I just put okay, but still put the mother's information in,
Yeah,
right?
yeah, because she'll be the primary person on the policy, even though she's not covered.
That makes sense. Okay. So good deal on that one.
Yeah. All right, so I've gone back to 70,000, three people in the house. It's kicking those two off the chip. So let's just go forward with this right now, and then we can change stuff later too. Um, Lost or losing health coverage. This part you can skip. It's just trying to ask you how much you use the doctor. It's going to try to recommend a plan, but uh, you're going to talk about that stuff. You can look up hospitals, look up doctors. You can get, if you get their email address, they'll have an account created under your name with Health Sherpa, and they can
Mhm.
go in and kind of manage it and make changes. And, it's good for them to do. They'll get notifications like if their premium, goes up or maybe didn't get paid or something. So, all right. So when we look at the plans, if you if you have a Sharpie marker right on your computer screen, silver plans get tax credits and cost share savings. So there's
Okay.
two
I don't.
different kinds of discounts here. If you don't have a
Okay.
Sharpie, just remember
Okay. Yeah, I was like, I don't have a Sharpie.
it. But all right, so you got two different kinds of savings. You've got tax credit and then you got cost share saving or cost share reduction. The tax credit everybody can get on any plan, based on their income. It just reduces the monthly premium. The cost share subsidy, it reduces the copays, the deductibles, the out of pocket maximum. It reduces the actual cost for health care for that person. Okay.
All right.
So we're going to look at all plans. Now you can filter these out. If you log into Health Sherpa, it would only show you Blue Cross because that's the only one that they'd have you, listed under.
Right.
Let's go ahead and we can come back and compare prices here in a minute, but let's just go ahead and filter out to the Blue Cross plans. And then they've got bronze, silver, gold. So bronze, silver, and gold. Don't get hung up on all that. You're going to wind up focusing on. Can you see my mouse like where I'm moving it around?
Yes.
Okay. You're going to wind up focusing on this premium and
Mhm.
this this deductible and these numbers right over here. Okay. The name of the plan, some of them do have some effect on it, but just don't worry about all these options. There's too many different options to try to memorize them all. All right. So when we look, you can see the bronze plan, zero premium. It was 373. She's getting like a $400 tax credit, so it pays it all. So she can choose that bronze plan for zero premium. Now, based on her income, she's not getting any cost share reduction. Okay. So she's still paying full
Okay.
price like everybody else for her health insurance when she goes to the doctor. She's got a $15,000 deductible, with an $18,000 out of pocket maximum. I mean, it's crazy. So with this bronze plan, you got to pay that amount before it really ever kicks in and pays anything. Uh, if you go down to the silver plan, look how much lower her cost share is.
Mm. Yeah.
Now, technically, the silver plan might be close or worse than the bronze plan. It's going to be in the same neighborhood, but you can see because she gets a cost share reduction, it's a lot less. So, anybody with a moderate to low income, you can even come over here on the filter and select silver. Now it narrows your options down to three. Does that make sense?
Mhm.
Instead of 38, now you got three plans you're looking at. And different plans have different restrictions. Like this select silver plan, they have to choose a primary care doctor for it to be effective, and it may require referrals to specialists. Um, the higher cost plans are more flexible. That's just an easier way to remember it. So if you don't want to have to check in with anybody or get referrals, you can pay more money and have more flexibility. If you don't mind, choosing a PCP and then getting referrals to specialists, um, there may be some doctors that are also not in that network. If there are specialists they're going to see, it's good to look those up. But um, other than that, you're just looking at numbers. And let's say the out of pocket maximum is 4,700 here, 6,000 here, and 4,400 here. All the
Yeah.
premiums are close to the same. I would probably eliminate the $72 plan, you
Mm-hmm.
know, and probably compare the lowest and the highest. I mean, you don't ever want to get into picking plans for people. You want to show them what you're looking at. And then if they want to talk about any of them, you can just talk through it. But uh, the out of pocket maximum is always an important number because that's the most they're going to pay in a year for uh, health insurance, health care and drug costs. Now, if you
Okay.
click on plan details, it'll show you a lot more about the plan.
Hmm. So it's real similar to ConnectSure, like when I put their stuff in for Medicare.
Yeah, this is like a Medicare summary of benefits, and it's even called that. Look right here, summary of benefits.
Oh yeah.
When you click on that, I mean it's an ugly, busy document, but it answers all your questions in here.
Yeah.
Gets into
Okay.
limitations and
Seems
y'all.
pretty simple though.
Yeah, yeah. It's. I mean, I don't want to dumb it down too much because what happens is you think it's simple, and then everybody's got a different question, and you think you don't know anything. So, but yeah, it is simple. Once you do a few of them, you get more confident with it. Um, since we're on this plan page right here, let me mess with the income one more time, and let me show you how it affects these plans.
So y'all are in contract with just Blue Cross, correct? Is that how that's working with y'all?
Yeah, currently we only contract with Blue Cross for ACA. With Medicare, we're not exclusive with anything. Uh,
Mm-hmm.
they had never worked with agents before, and uh, part of the way we got them to agree to work with us and trust us is that we agreed to be exclusive. And they are looking at that now to see if it's beneficial or maybe they need to change it. But for right now, that's how we've got it set up. All right, Monica, help me out. Where can we edit this person's? Here we go, right here. All right,
There you go.
let's take the kids off and just focus on the person. That was all for a
Mm-hmm.
$50,000 income. Let me bump it up to 70, like you said earlier. See, now that premium goes to 480. Out of pocket maximum goes to 9,000. Let's look and see if we put that household back to 3. Let's see what happens. See, back down. So the amount of help you get on the premium and the cost share is based on your household size and income, not how many people that are on the plan. Does that make sense?
Right.
That's why your friend that's coming off of the daughter's coming off of Medicaid. Well, if they do a household application and just insure the daughter, her discount's going to be based on the whole calculation of the household size and income. Sometimes that helps, sometimes it hurts. In her case, it's going to help because she may not even have income. So she might not would be eligible for a tax credit on her own.
Right.
Sometimes you've got somebody living at home that's still on their mom's tax credit that maybe the household makes a lot of money, but the individual only makes $20,000. Well, they get penalized because they're being claimed, by their parents still on their taxes. So to qualify for the savings, they have to fill out their own tax return. Um, Let me bump this down to $30,000. All right. So
Oh
if some,
wow.
yeah, if somebody was making $30,000, $2,000 out of pocket maximum, no charge at the doctor, no charge for generic drugs, zero premium, zero deductible. That's pretty easy to sell.
Right. Absolutely.
And even if they wanted the most flexible plan, look, their out of pocket maximum comes down to 850.
Oh yeah.
They would only pay $43 for it.
That's not bad.
Mm-mm. All right, let's come down even lower. Too low. Oh, that's right. With a household size of three, it's 26,000, isn't it?
Yeah.
So that's the same. So these things are grouped. All right, this is hard to explain. I wish I knew a chart to pull up real quick, but they're in phases. It's like, have you ever seen the federal poverty level chart?
Mm-mm.
All right, so it based on household size and income, it will show you if they're 100% of the federal poverty level, 150, 200, 250. So, and I'll show you that chart. I'll try to pull it up, but between 100 and 150% of the federal poverty level, they all get the same amount of help. So they got them in groups. It's not down to the dollar. Does that make sense?
Right.
So somebody that makes 26,000 and somebody that makes 30,000 are in the same bracket. They've got the exact same premium assistance and cost share reduction. They've hit the maximum. Uh, Start bumping it up here and see where the breaking point is. All right, 35,000 still the same. It's the max. Tell me if none of this makes sense and I'll stop.
No, I mean it is. I get what you're saying.
So you bump up to 40,000 and they've hit that next bracket. They've hit that. They've probably gone from 150% of the federal poverty level. They've probably crossed into the 200, bracket. So now their plan changes. The out of pocket maximum's a little higher, premium's a little higher. So as it goes up, this stuff changes. Let me look right here. I'll probably get nervous and not be able to find it since you're on the phone. And that'll happen to you when you're on an appointment.
Oh mercy. I know. I'll just like I don't know. Hang on.
Yeah.
There it is.
Yeah, let's see if it'll give us. There we go. Oh, that's still not what I'm looking for. Let's see. Here we go. All right. So right there, you've got to be at least 100% of the federal poverty level to qualify for a tax credit. Okay.
Okay.
So that household size of three persons and family, remember they had to make at least 26,000 to qualify for a tax credit.
Right.
If it's just one person, so like in that example, if that lady, if her husband is claiming her two kids, then she'll just have one person on her tax return, one person in her family. Okay. She would only have to make 15,000. Where that hurts you is on the higher end. So if it's only one person making 70,000, she's going to pay more for her health insurance than that one person who had two dependents making 70,000. Does that make sense?
Right.
Okay. So just household size and household income drives it all. These charts are still not good because they only go up to 200%. But you can see based on your household size and income, you're a certain percentage of the federal poverty level. Okay.
Wow.
Again, you don't have to memorize this stuff. The calculator does that. It's just kind of so you can understand, why, well, I only made five more $1,000. How come my deductible went from zero to 1,500? It's because you barely crossed over the threshold.
It's a
Here's a
numbers game.
It's a numbers game. Here's a better one. It goes up to 400. So that lowest threshold is probably from 100 to 150. And then when we bump the income up, it probably went into this 200 to 250 bracket. You bump it up
Trying to see if,
again.
trying to see if I qualify. I'm just kidding.
Hey, we're recording this, so don't
I,
tell me.
I'm just kidding.
We could talk about it off the record. But yeah, you can see if you qualify.
No, I'm joking.
The only way,
Um,
Monica, if you want to qualify, you could adopt five kids and get down here in the eight bracket.
I don't have enough kids. I would have like triple what I got. We ain't doing this.
But you see how it all works. Do you have any questions about what I showed you
No.
here?
So, like, when you get ready to sign them up and you go to the plans, you find your plan. It says, it's kind of hard to see. My eyes are bad too. It says enroll now. So, you'll hit that button and you'll enroll them, kind of like you
Yeah.
did with the Medicare.
Yeah, that's right. Yeah, it's real similar to Connecture. Um
Okay.
and
That's what Erica did send me all that stuff. So, I started it and I made me a login. So, Abigail's at softball practice, a 3 hour softball practice. So we are going to sit here and I'm going to kind of review on it and read on it because I left the other two watching movies they got with Deborah. So we're going to kind of go through here and see what I need to
well that
do.
sounds good, Monica. If you got I mean, Heather's really, really smart on this. I showed you how easy it is. You've still got to go through your certifications and then
Correct.
you're already contracted, so that's good. They'll just turn the ACA part on for you. But uh, hang on one
I
second.
need to make sure the United